The topic given to us is on communication and language development across ages in autism. So let's begin with a short presentation. As usual in this webinar series, initially I give a short presentation for 35-40 minutes, and then we have question answer session. So often when we see speech and language and communication development in autism, we just consider about children, but it's a lifelong process. Communication and language development is across ages, and at various ages, children and adults with autism, they face difficulties to communicate. Even if they have developed their speech, even if they have developed their language, they face difficulties in communication. So today's topic is going to be more focused on communication. So we'll talk about communication and language development across ages with a special focus on autism spectrum disorder. Communication is not only about speech. Many autistic children want to communicate but struggle with how to do it effectively. So speech, communication, and language. These are often mistaken as one, but they are three different parameters. Speech is I can make vocal sound, I can make word, I can form words. That is speech. Communication is I can communicate with you, whether verbally or non-verbally. Even if I don't have speech, I may have communication. The speech is my thoughts, my needs, my wants, I can express to you. And I can understand your thoughts, needs, and wants. That is communication. And languages, the languages, English, German, French, Hindi, all those are the languages. So across ages, we keep on developing all three of it. Usually at early childhood, we see more of speech development, then it goes into language, and then it goes into communication. So for each, we have different parameters. For speech, we need to have our vocal cords, we need to have imitation, we need to look at the oreomotor sensitivities, and we work on speech, oreomotor skills. Language, we need to have vocabulary, grammar, to form sentences, two-word sentences, three-word sentences, question sentences. That is language. But communication is in a very broader aspect. Communication is I convey my thoughts to you. So I need to be expressive, whether verbally or non-verbally, both ways. So through gesture also I can communicate. Through signs also I can communicate. Through picture cards also I can communicate. But for that I need cognition as well, processing. So in communication, we have three things once again. One is reception, another is processing, and third is expression. So I receive what you want to say, then I process that, coordinate with it, decide what should be my response, and then I give my response. So there is a need which has arisen. I am thirsty. Now my brain will process this information that I am thirsty. How will I get water? I will have to ask for water, or I'll have to go to the kitchen and drink water, or I'll have to, water is there in front of me in a glass, in a jug, but I need to have a glass, so I need to ask for glass. That all is processing. And on basis of that processing, we have expression, our expressive language. So communication is not only about speech. Many autistic children, they want to communicate, but they struggle with how to do it effectively. They struggle with the cognition part of it. So this session will help parents understand how communication normally develops, how it may look different in autism, and what can be done at every age. So defining communication, understanding language development in autism. Communication is the process of exchanging information. As I said, receiving and expressing, exchanging. Language development in autism varies significantly, impacting social interaction and educational outcomes. Recognizing these differences is crucial for effective support. So why communication matters? Communication is the foundation of behavior. When a child cannot express his needs, emotions, discomfort, his wants, behavior becomes the language. In such cases, child starts alternative way of communication that is called behavioral communication. So in autism, many behavioral challenges are actually communication breakdowns, not defiance. So they are trying to communicate when a child is hyperactive, when a child is hitting, when a child is self-harming, when a child is throwing tantrums or aggression or withdrawal or anxiety. These all are mediums of communication a child is using. We often work on behaviors, but we forget to understand the communication behind the behavior. So children use behavior as a language, as a medium of communication with you. That's called behavioral language. And it comes naturally. They don't learn it for behavioral language. It comes naturally. If you see a child, an infant, when an infant is crying, a very young child, 0 years, 0 days, 1 day, 2 day, 10 days, 15 days, or 1 or 2 months child, when they cry, in their crying also they have patterns. For you and I, child is crying, child is crying, child is crying. We will just say this. But it's the mother, grandmothers, close family members, they would say child is crying out of hunger, child is crying out of sleep, or child is crying out of some stomach ache or gastric issues. Now, how do they come to know this? How do the mothers come to know this? Why child is crying? And we don't understand this. For us, child is just crying. The reason is that there are patterns in those cries. Now, next time when you see a baby crying, infant, younger baby crying, you try to do differentiate between those patterns. When child is crying out of hunger or child is crying because of some pain in body, stomach ache or gastric issues, which are very common, you will see different pattern of crying. That is their behavioral language. Through this pattern, they are trying to communicate because they are not verbal yet. So with their crying pattern, they are communicating with you. So in autism, what happens is since the language is not yet developed properly, so children start using their behavior as communication. So we, like me being from the psychology field, we majorly work on behavior. But side by side, teaching alternative communication is very important. Once they learn alternative communication, half of our behavior problems get settled. So communication is sharing message, verbal or non-verbal way, includes gestures, facial expressions, behavior. Language is a structured system of words and rules, grammar, receptive and expressive components. So in communication, I am sharing my message. I'm receiving your message. I'm saying my message. That is what I'm thinking, my thoughts, my needs, my wants in a verbal way or non-verbal way. And it includes gestures. So if you and I, suppose we are traveling, I am traveling somewhere, you are traveling somewhere, by chance we happen to meet at the airport. I see you, you see me. And I just smile at you or I just wave, hi. That is communication. If I look at you and purposely ignore you, that is also a communication. So, gesture or absence of a gesture, when expected, both are communication. So, I look at you, the expectation is that I should say hi or you should say hi to me, but I purposely, willingly ignore. I look at you, I make an eye contact, recognize you, and turn my face and go. So, absence of a gesture when expected is also a communication. So when child is withdrawing from something, when child is not involving himself in something, that is also a communication in autism which child is trying to make, that I am not comfortable or it is too difficult for me or I don't feel doing it right away. So it's not that child will always say it verbally, but even if child is not involving in some activity with you, which he is expected to involve, which he usually involves, that is also a communication we need to understand. Not necessarily child will always be hyperactive. If child is not making an eye contact, that's also a communication. Facial expressions are also communication. Behavior is also communication. Language is a structured system. Words and rules, formulation, WH questions, receptive language, expressive language. That is a different thing. But communication is more important. Language, children will develop, speech will develop, therapists are working on it. It takes time for speech and language to develop. But first thing we need to start as parents need to start with is communication. We should start understanding behavioral communication of the child. Child feels comfort. Child feels okay, at least child is able to convey his thoughts to you. So we should start understanding our child with gesture, facial expression, and behavior, and start teaching them gesture communication or alternative ways of communication in autism until the speech and language is being developed. So a child might communicate without language as crying, pulling, taking your hand, screaming. And a child may have language but poor communication, like repeating words, talking without purpose, not responding socially. So, what is more important, language or communication? Both are important, I agree. But more important is communication. At least child is communicating to you. Rather than child is not talking to you, not responding to you, not responding socially, even though he has language. So even though child has language and if child is not making two-way communication, that means we need to work on the communication part of it. So in autism, we focus first on functional communication, not just speech. Okay, speech is speech therapists, they need to work on it and they do it. But first thing is functional communication. Functional communication is their day-to-day activities, day-to-day communication, whatever they want to express, that should be that they should we should be able to work on. So this will leave them with less of frustration and more of learning. There are components of communication like eye contact, gesture and pointing, sounds and words, facial expression, body language, and use of communication for a purpose. So communication should be used for a purpose only, and eye contact should be developed, gesture and pointing should be developed, joint attention should be developed, and then facial expressions, body language, sounds they make, words they speak, all are the components of communication. And in languages, we have receptive language, expressive language, and pragmative language. Receptive is understanding, reception. So whatever you are saying, I'm receiving and I'm understanding it. Expressive is expressing or speaking. So based upon the reception, I'm giving my output, that is expression. And pragmative is how to use my language skills in the social sector. Social use of language. I know the language, I have learned the language, but am I able to use it socially? Am I able to use it in my day-to-day communication? If I'm using language in my day-to-day communication, that is pragmative language. So the essential role of communication, the essential role is understanding communication significance in autism is crucial. It empowers educators to support students effectively, fostering their language development and enhancing social interaction with classroom environment. That is for the educators. Same goes for the therapist for giving them therapies and teaching them. So communication is the first thing that we need to work on. And in communication, there are components, eye contact, gesture, pointing, sounds and words, facial expression, body language, and using communication for a purpose. All these components we work on. The first thing we need to start with communication, and then speech and language can follow. So communication development is age dependent, follow a predictable sequence. The rate may vary from child to child. Delays can occur at different stages, and early support is better outcome. We all know by now, we have been attending this series for long now, so we all know that in autism, early intervention gives us better results. So yes, early intervention brings better outcomes. So early childhood communication milestones, if we look into. So typical developmental milestones are understanding them is crucial for recognizing delays in language. First, we need to see whether there is a delay in my child, which is usually very much common in autism. So whether delay in my child with autism, delay in language and communication, and what are the activities parents can use, what strategies we can use to help and support our children. So 0 to 6 months, there is a stage which is called pre-communication stage. 0 to 6 months of the age. 0 is like when child is born, and 6 months is 6 months. Just give me one moment, please. I'm sorry. So 0 to 6 months of age is called pre-communication stage. This is the stage when children are developing their communication. So they start more of behavior communication. So crying for needs. So whenever they have a need, they cry. Eye contact starts, smiling socially starts, respond to sound. So whenever they hear a sound, they respond to it. Whether you're taking their name, even though they don't understand their name, but they respond to the sound. They respond to the tone. And coos and vowel sound. So they start making coo sound, coos and vowel sound. If 0 to 6 months, you see that eye contact is not there, they are not responding to sound, smiling is rare, or vocalization, cooing and vowel sounds is very limited, then we have a red flag that the child is delayed on communication. 6 to 12 months, we begin the foundation of language. So, babbling, saying baba, mama, responding to name, using gestures like reaching, waving, and joint attention. That all begins between 6 to 12 months. So, if a child is not showing these things in 6 to 12 months, like child is there is no babbling, no response to name, no pointing or gestures, or limited social engagement is there, that means the child might be delayed on language, speech and language development. Then 12 to 18 months, we see first words. So child says 1 to 10 meaningful words. So child may say one word or 10 words, 9 words, 5 words, up to 10 words. Meaningful words. Child starts in 12 to 18 months, 1 year to 1.5 years. Understand simple commands, uses pointing to communicate, gesture, pointing, and imitates sounds and action. Child starts imitating your actions and imitating your sounds. Whatever you are speaking, words, child's or the sounds you're making, child starts doing it. But if child is not speaking meaningful words, child is speaking words but no meaningful words, 1 to 10, then it is a red flag. If imitation is not developed, it is a red flag. Limited understanding is there, then then it is a red flag. And prefers object over people, that is also a red flag. That child is avoiding communication. 18 to 24 months, word explosion. So vocabulary increases rapidly. Where a child was on 1 to 10 words, now vocabulary increases. Child starts combining two words also. Child starts naming object also, and starts following simple instructions. But red flag is if child is 18 to 24 months, child is less than 20 words, or no word combination, not combining two words, come here, go there, or I want. Regression in speech, if you see that earlier child was speaking, making sound, and now child is not making sound, or child was on 5 words, 6 words, 10 words, and now there is a regression, words have gone down. And frustration with communication, child starts getting hyper, or child starts getting uneasy, gets child gets frustrated with communication. When you are trying to build a communication with child is not happy with it, starts avoiding you. These are the red flags that this child has concerns in communication. 2 to 3 years, early sentences. So 2 to 3 word sentences child starts making. So I am going, are you coming? Not are you coming, but yes, I am going. Or ask simple questions. What is this? Why it is? Uses language to request and comment. So child starts requesting, that is need, but commenting as well, and understandable to familiar adults. So child speaks language and words which is familiar to like similar to the adults who are speaking, which is understandable. If child is on single word, echolalia without meaning, so child is just repeating words or making sounds without meaning. There is no meaning to those words. That is again a red flag. Limited understanding or minimal social communication. Then it is a red flag that we need to find out if there is a speech delay or speech communication delay. 3 to 4 years, longer sentences, answers what and where, tells simple stories, and pretend play with language. That all starts in 3 to 4 years. Whereas the red flags are speech is unclear, limited vocabulary, difficulty in answering questions, and poor interaction with the peers. Child does not mix up with other children, a child has poor interaction. So these all are the red flags which we see in 3 to 4 years. 4 to 5 years is the time for language for learning. So child starts using language for own learning, making complex sentences, uses grammar correctly, understands the concepts, and social conversation develops. So difficulty expressing ideas, poor sentence structure, limited conversational skill, or literal understanding only. That child does not understand the concept, child just understand literally, just word by word. But concept child does not understand. Such cases, yes, child may be struggling with communication. Though the language has developed, though the speech has developed, but communication part child is struggling. Then comes the time when child is school going child. During school age, child has started going to school after 4 or 5 years. And this is like the time when child faces, if there is a delay in communication, child faces a lot of concerns with the peer imitation, sharing, connecting with other children, and his or her learning gets hampered directly. So during school age, children with autism experience unique challenges in language development. Social communication skills evolve, but many struggle with pragmatic language and understanding context, requiring tailored support and intervention. So, though they have developed their speech language, they have started communicating also, but social use of communication, holding on a conversation, carrying on a conversation becomes difficult. Imaginative discussions, play, that becomes difficult for them in autism. So at this stage, we need to provide them support. So 6 to 12 years, school age communication, academic language, they have narratives and explanations, they have understanding humor and emotions starts, and peer interaction becomes critical. And challenges what we see in school ages in autism, literal language. Though they have language, but it is literal, straightforward. What you read, what you speak is straightforward. No, they don't understand the academic language, they don't understand the conceptual language, difficulty with abstract concepts, they don't understand, poor conversational turn taking, and social communication deficits. So they start keeping away from other children, they don't mix up with other children because they are not able to hold on a conversation. Social communication part is lacking there. That happens throughout the school. And then comes the stage of transition, that is from school to adolescent, childhood to adolescent. So adolescents also in autism, they also struggle with things. Though the speech language has developed and they have done fine in academics, they have been good in their school, we feel that they are out of autism symptoms. Mainstream schooling also has started. But then comes the age which is adolescent. In today's topic, I want to really discuss about this part because this is the time when we don't think about speech and language or communication therapies. We don't think about providing support because the child has been mixing up with other children, child has been in mainstream schooling and has been learning, but his communication delay is also affecting him, which he has learned to mask. School age, it is simple, it is easy, and child has done it. But when it comes to adolescents, it becomes difficult. They are going through a lot of hormonal changes, physical changes in body, and teenage issues because of that. We all know that. And confusions, stage of confusion, and same time, communication challenge. So, adolescents and young adults with autism often face challenges in navigating complex language use, including understanding abstract concepts, engaging in conversations, and interpreting social cues effectively during interactions. So they should be participating, they should be able to do debate and reasoning, they should be able to express their emotional expressions they should be able to use, perspective talking they should be able to do, and self advocacy skills they should have. But often children with autism struggle in all of these areas. They have difficulty expressing emotions even though the speech language part is developed, but they face difficulty in expressing emotions. They feel social isolation. They have limited pragmatic language and anxiety in conversations. This is what creates a lot of misunderstanding between them and their friends and their family members. Already the struggle of hormonal changes, changes in thought process, physical changes in body, everything is going on. On top of that, this is something which comes up. And that's where they feel helpless. Because as parent, for us, everything is going on smooth. They have, okay, we have given enough of support after 10, 12, after 12 years of age. Now they are left on their own. They are going to the school. They have their friends. We don't interfere much. We don't think about providing support and providing therapies to them at this age. Speech therapy has already been stopped before 4 years. This is the age when we actually need to support them at adolescent. Then comes, once they pass out the college, they have become an adult. Then comes again the challenge, transition. So transition from childhood to adolescent is the time when we again need to provide therapies and support to the child with autism, which is usually missing. And transition from adolescent to adulthood. That is the transition time. Again, we need to provide therapies. Required therapies, whatever is required, be it the behavioral, be it the counseling, be it speech language and communication, majorly communication part of it. So all of this we need to provide them during transition stages, adult, childhood to adolescent and adolescent to adulthood. So as an adult, I should be able to have functional communication, workplace communication, relationships, problem solving language, and emotional regulation through language. But in autism, they find it difficult. They find it difficult in doing functional communication at this stage, self-expression, workplace interaction skills they lack, and speech therapy. This is how speech therapy, which we call, speech therapy together is for speech, language, and communication. So that is relevant across the lifespan. That is not only for children, that is for adolescents at the time of transition, that is for adults at the time of transition. So what affects communication development? Brain development, environment and stimulation, screen exposure, emotional security, and sensory processing. So while doing therapies, we need to work for the each area. When we want to develop the communication, we need to focus on each area and provide the support. How we can provide support? What is the role of parents and what is the role of therapists? So parents' role is to do responsive interaction, talking throughout the day, keep on communicating. More they communicate, more they become comfortable with. Reading and storytelling, reducing screen time, and following the child's lead. not the instruction way of teaching, not the instruction, but child's lead. Let the child lead the conversation and you follow. You jump into the conversation, you talk, but let the child lead the conversation. Role of therapist is speech and language therapy, ABA-based communication strategy, social skills training, and AAC implementation. AAC is what? Alternative augmentative communication skills. So best outcome occurs when therapists guide, parents implement, and schools collaborate. Integration of all. Interdisciplinary approach is essential. So alternative and augmentative communication. This is like the alternative communication. Till the time speech language is being developed, we give alternative options to the child to communicate. So we have picture exchange communication system, that is called PECS, where we have the picture cards which child starts communicating with. Say we have card for with food items, so child just picks up that card and gives to us, so we understand child wants to eat food, this food or fruit or tea, coffee, milk, whatever. We have gesture and sign communication, where with gestures, like if you want to have a break, you need to raise your hand. If you want to go to washroom, you need to say this. If you want to like show this gesture, if you want to eat something or drink something, you need to show this gesture, like gesture and sign language. Then we have communication apps also these days. So we have a lot of application and instruments to communicate with, which help in communication. So it works like PACS system, where child sees the screen, there are buttons or there are pictures on the screen, child clicks on the picture and forms the sentences, or it speaks out. So child is clicking on it and it is speaking. And visual support. Visual support is we have those cards, visual cards, which we place in different places so child understands where what thing is there. So the direction signs, toilet, washroom, all those day-to-day activities, what comes first, what comes next, like the visual card system, which we provide to the child. So these all are the AAC communication system. There is a myth that AAC, if I introduce to an autism child, child will never speak. But it is not that. AAC, when used effectively, helps in communication, reduces behavioral concerns in children. They feel more empowered, more happy with AAC. But it doesn't mean that they don't develop speech and language. With correct speech therapy, they develop their speech and language side by side. So AAC is a bridge, not a barrier. Research clearly shows AAC reduces frustration, improves speech outcome, and enhances independence. So don't go with this myth that, okay, if I introduce AAC to my child will never speak. Children with autism, they do speak, they do develop. Early intervention is important, yes. So as early as possible, if we provide intervention to the children, that's why we have started looking at the delayed speech and communication right from the age 0 to 6 months. We have started screening now. Within 0 to 6 months, we are providing therapies, speech therapy to children even for 6 months children. Earlier, it used to be that let the child grow up, child will, the language will develop or speech will develop on its own. Till 5 years they used to wait, 6 years they used to wait. But nowadays, we provide therapies even to 6 months old child. So because at early stage, we have seen in the previous webinars also that brain plasticity is very high. The brain is developing and neural connections and plasticity is very high. So it helps children learn very fast in early stage, prevents secondary behavior. So if early stage we start with the therapies, then the other behavior concerns do not come. Improves independence in children and enhances quality of life. Quality of life not only for the child, but even for the family, all of it. There are common myths and facts about communication. He will talk on his own. Give it time. His uncle also spoke at the age of 7. His grandfather also spoke at the age of 7. All these are myths. So if there is a delay in speech and language development, we need to provide support as soon as we come to know about it. We need to keep on screening our children, monitoring our children, and provide support as soon as possible. AAC delays the speech because child has got alternative options. So why would child speak? That is what they debate on. But no, AAC does not delay speech provided child is not left only on AAC. AAC plus speech therapy side by side. If both things are going on together, AAC helps us. It does not delay. Boys talk late. This is also a myth that boys talk late, girls talk like early. Therapy is only for severe cases. No, therapy is for every case. Even there is the smallest support which is required, therapy is for that. Bilingualism causes autism or delay. That if child is put up on two languages, it causes autism or it causes delay in speech. Child is confused. No, children can learn multiple languages same time. So bilingualism does not cause autism or delay. Autism does not mean inability to communicate. It means different pathways. It is the fact. So autism does not mean that child is unable to communicate. Child is not able to communicate. It means child is communicating to you in his own style, in his own way, through behavior, through gesture. You need to understand that. It's like I am speaking in English right now, and people who are here, all you participants, understand English. That's why you are here. If you don't understand English, you will not stay here for long. So you and I, we have common language. Common language is English. Some of you may know other second language, third language, fourth languages also. I also may know some other languages. But since we have common language, we are able to communicate. Now, same thing is with the child. Child speech and communication and language is still developing. So child does not have any other language. Child has his behavior language, gesture language. Child is trying to connect with you right from the age of zero day. Child is connecting with you, making attempts to connect with you by cooing, by making sound, by screaming, by hitting, different by doing tantrums, different behaviors. Every behavior communicates something. So we need to first start understanding their communication, understanding their behavioral language, and connect with them. Connection is the key. Once we connect with them, then we can explain them in their own language to start with, their own language, and slowly we can teach them our language, whichever language we want to teach them. There are some home-based communication strategies, that is, model simple language, give options, wait and respond, expand child words, and use visual cues. So as parents, when you talk with your child, you can model simple language for them. You can start speaking to them in simple language. Give them options in everything. At least you are helping them, even if child is non-verbal. Most of the time we have seen if child is on one word, we also become on one word. If child is non-verbal, we also become non-verbal. Child is non-verbal. Child is not able to speak. Child is not deaf. Child can hear you. So we need to speak to them in our language. So at least by the time child becomes verbal with the help of therapies, child gets the vocabulary. If you give options, if you talk to them, they are listening. They are understanding the meaning of those items, vocabulary they are getting. They are saving that vocabulary. They are not using it right now. But the moment child gets his speech, child gets his language, child will very fast child will pick up this. Wait and respond. So you need to wait for the child to initiate conversation. Child should make you should give options to the child. Oh, sorry, you should give time to the child to kind of take initiative to communicate. You know child is thirsty. You know child is hungry. You need to wait and let the child initiate. Let the child try to communicate with you. Understand with that communication and then respond. Expand child's words. So whatever child is trying to say, expand that. Child says car. You say you want red car. Child says water. You say you want cold water. So whatever child is speaking, you need to expand that. Even if child is at one word, you expand, child is getting more of language input, more of vocabulary input. And use visual cues. So you wherever possible in your house, you can use visual cues so that child knows what to do next, like in routine, say bathing routine in the morning, toilet routines. You can create picture cards, put it on the back side of the door, let the child see what to do first: brushing the teeth, toileting, taking shower, washing face, washing hands. All of this step by step in visual cues so that child knows what to you do next. Akansha has written, do share PPT. Yes, Akansha, I'll share the PPT in WhatsApp group. I hope you are in the WhatsApp group for webinar. I'll share the PPT there. You will get it. So message for parents is trust your instincts, observe and engage, seek guidance early, and celebrate small progress. Even if child is making small progress, you should celebrate. Together, we can enhance communication. Key takeaways for this from this discussion are: communication develops step by step. It's a process. Early signs matter. Support can change outcome. Every child can communicate. Every child can communicate. Language is okay. Child, there are children who stay non-verbal also. That's fine, but they can communicate. Every child communicates. Every child can communicate, and every child communicates. Communicates through behavior, gesture, and our role is to understand their language, expand their abilities, and respect their neurodiversity. That's all. Collaborating with families and educators is essential to develop tailored communication approaches. So the therapist should collaborate with the families and educators. Understanding each child's unique needs enhances support and promotes effective communication growth throughout their development journey. That's all for today. Now I'm open to the questions, if any. So we have created a WhatsApp group. Yes, Akansha writes, yes, sir. Thank you. Okay. So we have created a WhatsApp group for the webinar people who are attending these webinars, this whole series. So I I will ask the you can reply on the email. People who have received link from email or WhatsApp, you can reply on the email or WhatsApp if you want to be added in the group. You will be given the group invitation link and you can join the group. So PPTs recordings will be shared in the group, and I also at times I share some study materials, relevant study material related to autism in the group as well. Yes. Any questions? Okay, Mary has a question. Hi, sir. I have heard people saying that AAC like Awaz app is being used by the child regularly along with speech. One day child will stop speaking and depend on AAC app and stop communicating. Is that true? No, Mary, that is not true. If child is just left on AAC, there are chances that child will not attempt to speak. But if speech therapy is going on side by side, speech and language therapy, then there is no challenge to it. So it's a myth that if the child with autism put up on AAC, then child will not speak. AAC is a supportive tool. If a child with autism is put on AAC, we can handle a lot of other concerns, lot of other challenges of the child, and chances are child will start speaking early because it will help him in regularizing himself, expressing himself, and he will be more confident. He'll be more relaxed to learn new things because his state of mind will not be confused or tensed state. He is able to communicate with you through AAC. But yes, because he looks around, parents, family members, therapists, all are speaking. So definitely he'll make attempts to speak. So this is not true. Login says my son started counting, then he stopped. Now he does not do at all. Yes, this happens. This happens in autism. It's a very common sign that sign of regression. Children start learning and then they stop or they go back. And you need to consult your therapist or do a detailed analysis of the situation, why it has happened. Many of the cases, what we have seen is uh, environmental effects, especially depression in pediatric cases. becomes the reason of regression. So children also go through depression. We usually talk about adults and depression, but children also go through depression. And in autism, there is a research which says children with autism are 4 times more prone to depression. 4 times more chances are there that they will go to depression. Why? Because of the environmental factors. They are left alone in schools. They are not able to connect with other children. They are not able to connect and speak with family members. So all of this they face, their thoughts, their needs. They want to communicate to you. They are not able to. Their development is different. They find themselves different. So all of this creates some stress in them that leads to depression. And because of this, child may go into regression also. Because regression is a very common symptom in depression. Children, people, even adults get into regression. They slowly start forgetting their areas. They slowly start missing their daily routines and start, their brain tries to shut down. So they don't take any more input. They don't want to learn new things. They don't want to communicate. So these are very similar symptoms which we have, which we see in adults in depression, and children also. In autism we see regression. In regression we see these symptoms. So we need to do an analysis of the environment and make the environmental corrections, and definitely child can overcome this. That is not something to be really tensed about, but yes, we need to take corrective actions as soon as possible. Any techniques for overcoming regression? Yes, environment. How to overcome? First thing is be observant, don't let the regression come. So how we be observant? Regression doesn't come in a day. Regression takes its own phase. So whenever you see that child is going slow on learning phase, the behavior is changing, mood is changing, and persistence going, graph is going down towards downfall of learning curve, you need to be immediately attentive. Keep on screening the environment of the child, because triggers are in the environment. Triggers for regression, triggers for depression are in the environment. So keep on screening that. So don't let it happen. But even if it has happened, we can overcome it by making corrections in the environment. We need to do child environment analysis. So child environment is consisting of three things. One is physical spaces where the child is. School, home, therapy centers, all of this need to be screened. Then people the child moves around with. The caretakers, the grandparents, the family members, parents, therapists, and educators. All of this makes people child environment. And then the materials, the toys child uses, the materials child we use for therapies, all those instruments, materials, toys child plays with. So all three needs to be screened. What is changing, what is disturbing, where the triggers are. So we need to find those triggers. Once we are able to find the trigger, we are able to solve regression issues. But it is possible. It is common. Regression is common, and it can come at any stage of life. Not only children, but even adolescent, transition time, adulthood time. We see regression. We can overcome that. Divya says, my son is 3.9 years old. He is under therapy since from March, and he is progressing. Great. If we teach academic concept, does it affect his language and communication part? Because my therapist suggested not to teach any by heart learning like that. Now, I do not know, because I need to screen the child's profile in detail to comment on it, since your therapist has told not to teach academic part. But in general, if I say teaching academic concept does not have, if the child is learning and progressing, so there is no harm in teaching academic concept. But child is just 3.9 years. Maybe your therapist does not want to put more pressure on the child and wants him to learn in his own pace. That is the reason your therapist might have said this. So I cannot go against the opinion of any of the professionals. I respect each individual, and I respect their decision. So they might have, she or he might have taken decision looking at the child profiling. So making a general statement, if I say There is no harm in teaching academic concepts even to a child of 2 years also. But whether the child is prepared for it, that is important. So that does not go with age, that is chronological age. 3.9 years, 4 years, 5 years, that is calendar age, chronological. We need to see developmental stage. So whether the child's mind, brain is ready to take more inputs. If child's brain is ready to take more inputs, there is no harm in doing that. But yes, if there are intensive therapies going on and we don't want to put any more pressure on child, we want to give him his own pace, then we may suggest that not to go for it. Okay, Divya? Logan, he even did his ABCD until Z, but now we cannot get any alphabets from him. What causes regression? I have already answered, Logan, what causes regression. You may connect with me separately. We can book a slot for you, and we can do a detailed discussion and detailed analysis of the environment and try to find out what could be the reasons of regression and how to overcome them. We have to plan. It's a process. So we have to like do a session together one to one and need to understand child's condition, your environment, and what has changed in the environment, what could be the triggers, find the triggers, and then work towards it. Akansha says, can you please talk about reflex integration and how autism is impacted? Yes, Akansha, reflex integration is a big topic, will not be covered in just one or two sentences. But yes, I will involve this into the future webinars. I'll keep in mind and I'll involve. Yes. So reflex integration, we will keep a separate session on that. As sensory integration, reflex integration, we need to keep separate sessions. Does Leucorvin help in developing communication? Leucorvin, I have already, in one of the previous webinars also, I've answered this question that yes, if the child has folic acid deficiency, folate deficiency, then in that cases, Leucorvin is helping children, but not all children. So first you need to do a folate test for your child and see if there is a deficiency for folic acid, then only you should give Leucorvin. It's a medical drug which should be given only with prescription. So you have to, I'm not the right person to comment on it. You have to go and meet a medical professional, licensed medical professional like a developmental pediatrician, pediatric psychiatrist, and get it prescribed if they are of opinion that it is helpful for your child. It's a common myth that Leucorvin is helping all children. No, it is not helping all children. It is helping only those children who have folic acid deficiencies. How play materials affect regression? If there is a trigger in play material, if there is a trigger in the material, it is affecting regression. Why? Because the material I'm playing with, I have been playing with this, but it is not giving me learning opportunities. I'm not learning anything more from it. That can, or it's not only material. I spoke about material as in material and instruments, whatever we use for therapies. There might be concerns in them. Child is using them, but child might find it very difficult to use. So child goes into the withdrawal stage. Difficulty level is high. They are not age appropriate. They are age appropriate as per calendar, but not age appropriate as per development. A young infant child who's 1 year or 2 years would not like to play with the toys of 10 years old boy. They would like to play with the toys of their own. Now, since our child is 5 years, but his developmental age is 2 years. So we give toys of 5 years or materials of 5 years because we look at calendar age. But his developmental age is 2 years. He would connect better with materials of 2 years age appropriate of 2 years, not 5 years. So that does not directly impact regression, but that is part of environment, I said. So analysis, while doing environmental analysis, we do analysis of all three: people, um, physical settings, physical where the child lives and where all child moves, and the items, instruments, the toys and all those materials which child uses. Shreya says, Doctor, what might be the reason for child repeatedly drops toys from a height and enjoys watching them fall? And this behavior sometimes lead to overstimulation. How can this behavior be generally supported? reduced or redirected in a healthy way. Okay, so it could be the inclusivity in the child. The child is dropping toys. This is a very common thing. Children who live on higher floors, they love to throw things, they love to drop. But we need to do a detailed behavior analysis of this behavior. What child is achieving by doing this behavior? That we need to say. Whether child wants to escape from those toys, that could be one thing. When I'm bored of something, I know when I throw something, you get me something new. So that could be one of the reasons that I want to escape from it. Or child is doing it just for the inclusivity, that how down it goes, how it goes. Like we all like to, have in our childhood, we all used to like to have those planes which we used to throw and see, look at them, paper planes we used to play in the school with them. So it could be just the inclusivity, it could be the escape mechanism, that I want to escape from it and I want to get something new. We need to, or when you throw things and mother shouts at you, attention. So I get the attention function. Her purpose is attention. So whenever I want my mother's attention, I will throw something now. So mother will shout at me, and with that shout, though it is negative attention, it is shouting, but child is understanding it as an attention. So maybe it is attention. So we need to do a detailed analysis, the ABA analysis, the ABC analysis, antecedent, behavior, and consequence. Link it to the function. What is the function of this behavior? And then we can create a behavior modification plan on this. Mary says, sir, when can a parent stop a speech therapy or OT for a child, by what age? There is no age to stop. It is as per development. As child develops, the child has learned functional uses of language, child is comfortable with language, we can stop it. So there is no age. Some children we may stop it at the age of 5 also, and some children we may have to continue 12 at the age of 12. So we need to see the development of the child. So if the development is at par with the age, if the development is at par with the developmental milestones, we can stop it. Divya, if I provide any toys or material to my son, he is lining them up. Very common trait in autism, that children like to line up toys and materials in autism. It reduces by engaging with other activities, but then when he is alone, when I do my household activities, he starts lining up his toys. How can I help him to come out of this thing? We don't have to help him to come out. Let him line up the toys. It is a trait of autism. They like to line up the toys. They like to play with part of the toys. They like to play with tires of car, spinning objects. So these are common traits of the toy. Let them do it as long as it does not harm their learning. So in autism, we have many concerns, behavioral concern, many concerns, which I suggest not to be worried about. As long as they are not affecting your child's learning, we should not disturb it. We should not be worried. There are many sensory behaviors which we say we should not be worried about it. Like parent come to us and say, my child does hand flapping when he is excited. It's okay. When you are excited, you laugh, you jump, your heart beats faster. Your child does hand flapping when excited. No problem. It is, if it is affecting your child's learning and development, then I will work on that area. Otherwise, we will not work on it. So it's a common trait of autism. In fact, when children start lining up toys, we suspect autism. So we need not to worry about this. If it is not affecting his learning, let him do it. It's his normal style of playing. Accept it. So neurodiversity in autism, we need to accept also. It's not that everything we want to make them perfect like us. We all are also different. Each individual, we all are different. Same as the child. So let him enjoy his uniqueness. Okay, Shreya, thank you. Mary, thank you. Any more questions? Anyone? It is not helping him to learn typical play. So what we can do is to learn, we can have separate play time where we are sitting with the child with single toy and helping him play, or two toys and helping him play. But when we are giving him free time to learn, free time to play, let him play in his own style. So you can include learning typical play as a goal in your goal sheet, in your basic therapy plans. You can include that. But let him also enjoy his own me time. So this is his own me time, let him enjoy. But rest of the time, within the therapy goals, you can include how to play with toy, or how to be functional with these toys. What is the purpose of this toy? How does this work? So take one toy at a time and let the child learn. Let the child play with it, learn how to play with it, instead of taking 10 at a time. That we can include in an organized way in our therapy plan. But when child is left alone, when you are busy at your home household activities and child is left alone to play for 2 hours, 1 hour, let him play. From lining up also, he's learning something. Don't worry. When he's lining up also, he's learning which to come first, which to come second, how to create a line, how to connect them. That he's doing it. Okay, Divya? Yes, thank you. Thank you. All right. So if there are no more questions, we will end the session for today. See you all next Sunday then with a new topic. All the best. Bye bye. Keep learning, keep growing. Let's create a support system for children with autism. Slowly, we are going towards adolescent and adulthood. So, thank you. Thank you, Dorothy. Thank you, Shreya. Thank you, everyone. Bye bye.